Sorry, I've just had a message there. Thank you. Councillor Stevenson, you have your hand up.
Thank you, Councillor Hemsley. I don't want to look as though I'm shooting the messenger, because I appreciate this is partnership working. In terms of supporting this paper, the principle behind it, i.e. placing the resident, the patient at the centre, so their access to the right pathways happen really smoothly, and those transitions between services are really smooth. I completely support that. This report, though, feels really, really vague, and I'm not 100% clear what we're signing up to. The potential implication on revenue cost, I would like that risk being much more explicit. And I think really I agree with what Councillor Rozelle is saying. It feels quite vague. The principle I completely support, but I really would want more detail before signing up on the dotted line with this. I think it's a really complex area, and I just need to understand more fully what this is actually going to look like in terms of delivery and those implications for us as an authority.
Thank you. John, you have your hand up again.
Yeah, it's just to give assurance, really. So this paper is fairly vague because we don't know the details. It's something that the government has told us that we have to do by September. And it's the core partners who are actually working on this rather than everybody in the ICS, which you'll see listed in the paper. What the paper's asking from members is to signal your intention to support the development of the SCR. It's at that low stage at the moment. We don't have the detail. This is support for our intention that we can then continue the piece of work. And while we're doing that piece of work with our partners, most of whom have signed up to this charter, we will seek the clarity while we're going, because as we get the detail, we can then seek the clarity, but we need the start point first.
Thank you. Mark, you have your hand up.
It was just to follow on from that, from John, just to remind Cabinet that obviously the first part of the recommendations are to note. The second one is around trying to make changes to the charter, around the issues that have been outlined by Councillor Waters and John. The question, therefore, is that if you authorise them to go and negotiate those changes, do you want it to come back, or are you comfortable delegating to Councillor Waters and Mr. Morley the delegation to approve it themselves, or do you want it to come back? So there's two elements here for you to consider, which is your right to pick up the concerns. The paper highlights some of those concerns. The question, therefore, is, if we go around to seek the clarity that we want, do you want it to come back, or are you happy delegating once you've authorised them to start that negotiation?
Thank you for that. Councillor Rozelle, you have your hand up.
Well, thank you. And yeah, Mark, I agree. And for the latter, because the detail is so important, so critical, it needs to come back.
Okay, can I put forward a possible suggestion that we have some caveat that is sort of specifies when or what triggers it to come back? I don't know whether that would be sensible, because if it's straightforward stuff, then I think it could be dealt with by Mr. Morley and Councillor Walters. But if it is more complex or involves increased costs, then I suspect it should be coming back to Cabinet for an understanding of where it's going. I don't know whether that would be possible.
Yeah, Oliver, I'd be happy with that. I think you don't want it to come back, just to be proofread. I mean, that would be silly. But when there is critical areas, and maybe that's the point of the paper needs to be clear about when it will bring information back to Cabinet and the terms of reference under which that would happen. So officers know already that I trust them, but there'll be some very, very big decisions that come out of this that could have workforce, financial, health, whole community activities. So I think we just need to be clear on those terms of reference.
Councillor Stevenson.
Yeah, I mean, I completely trust the portfolio holder and Mr. Morley. Needless to say, as Ian has said, for me, the 6.4 and the 6.5, 1.5 million budgetary revenue figure has been set aside. Contingency figure in case there is no funding. 6.5, we do not believe there are any direct finance implications. I just think it's prudent to have that due diligence that when there's a little bit more meat added to 6.4 and 6.5, I'm happy to support the delegated. In the meantime, I would like a watching brief, please, so that we can have some collective responsibility over it.
And then Councillor Wilby, you have your hand up.
And I'd just like to support that. I think I'm very happy for John and Councillor Walters to head it off for us, but to keep us in the picture. And as they're swimming in treacle, when they find a solution, I'm sure they'll tell us, and we can, give our approval. But I'm very happy to leave it with them.
Okay, Alan, you have your hand up.
Yeah, are members suggesting that we are authorised to enter into those discussions, but that we need to return to Cabinet if there is any revenue cost to the council or any risk of revenue cost to the council? Or are you asking us to bring the paper back just to look at the terms and conditions rather than just any financial risk?
I would suggest that if there's a financial implication beyond a certain point, that it would come back to here. And I think that's something we maybe need to make sure is clear. But reading the terms and conditions, then I think you can advise us on that. And if you felt it was necessary between you and John Morley to bring it back, then I would expect it to come back to Cabinet. Is that a satisfactory solution?
It's certainly satisfactory to me, and happy to seek support for that. Would members like to set a figure on it?
I don't know whether Sav could give us an indicator on that. I don't want to drop you in the spot, Sav, but do you have a sort of feeling of where we would start being concerned?
No, I don't have a figure on that, but can I just clarify something? As soon as a member of staff does anything in relation to this project, a cost is triggered, clearly. I think the report talks about no direct financial implications in the sense that we haven't been asked to stump up any upfront funding. Of course, there will be implications for staffing. So I understand that Cabinet may wish to understand more about what the impact on existing resources is, as well as assurance that we might not be asked to fund anything specifically. On that basis, I think it's quite difficult to give a figure. In the context of where we are at the moment, I'm sure we'd all like no staff hours to be diverted to do this on the one hand. So on that basis, I think it's just appropriate that we come back in any event. I think it's hard to put a particular line on it. I mean, what do we say? 10 weeks of staff time, 5 weeks, 2 weeks? I think it's quite difficult in that context, because 2 weeks might have an impact on on our existing service provision. So where do you draw the line? It's whether, for me, the issue is what is the extent of the commitment, and how does that impact on our current service provision and the choices we might have to make about what we do? It's hard to say. Well, 10 weeks might be, we can accommodate. Similarly, we might not be able to accommodate 1 week of staff resource.
I think that question probably needs to be directed to John Morley, doesn't it? On staff time relatively.
Yeah, yes, I'll be pleased to take that. Again, I think there's two parts to that, Leader. Firstly, we don't know the implications, and once again, this is one of the things that I stress we need to clarify, because we don't know. And there is a group of people of which adult social care is part of that are actually working on this, and I would see it mainly my own staff doing this. There is also a big positive from my perspective that would actually save on our resources. As always, there's a counter to these things, because I won't have my practitioners seeking for information from partners, which is something that we spend a tremendous amount of time on. It will be there at the touch of a button, and that also has a positive implication and effect on our resources. But I take the point and stress these are things that we have to clarify.
Okay, thank you. Councillor Rozelle, you have your hand up again.
Yeah, Leader, thank you. So I think we've just heard there that we believe that there will be financial risk. I think that's what Sav was telling us. We haven't discounted it, so therefore there will be. And I think we also need to be a little bit cautious about the fact that everybody shares their record, because they don't, of course. That's down to an individual patient. So whereas we might believe that we're going to access all of the records that are on file, the truth is somewhat different, and patients can decide not to share their record. So we would still be having to go through that laborious process that John has just articulated there. I'm not going to say any more. I think there's a risk with the paper as it is at the moment, but I would be just interested in others' views.
Okay, Phil, you have your hand up.
Yes, please, Leader. It's to make a suggestion on those boundary mechanisms that we were talking about for triggering a report to council. I think it may be a solution to say that if it falls outside of existing delegated powers or would constitute a key decision, then the matter should be brought back to Cabinet for consideration at that point. What that means is that if we're stepping outside of where we've got existing delegations, or if there is an impact that impacts on 2 or more wards or amounts to more than £50,000, then that would be brought back here, back to Cabinet for your consideration.
That sounds like a pragmatic solution. Alan, you have your hand up on that.
Yeah. Thank you for that advice. I would refer members back to 2.3. We're not going to have a choice whether to join in with a shared cared record system. We are going to do it, and we need to bear that in mind.
Councillor Stevenson.
Oh, if I can unmute myself. Very supportive with where this is going. This is a really general observation, and I appreciate it's out of portfolio for me. It feels like various things with our healthcare provision in a very general tone, where projects are set up which are quite vague, with sums of money mentioned, where ultimately we want to get the best outcome for our residents. And it just worries me. I've seen this sort of over a decade of rearranging things and starting projects, and so I'm just a bit reticent. I'm happy to support, Chair, but it just makes me feel nervous that lots of public money being spent and not necessarily getting what we want out of it.
Thank you. So I think sort of gathering all these thoughts together is something that we have to make a decision on by September. And therefore, I think we have to trust the judgment of John Morley and Councillor Walters, and applying the caveats that our monitoring officer has put forward, that should it be outside the financial budgeting, I'm not quite sure how you word it, but I'm sure we can add that to the recommendations if that would be possible. Then we can take that and move forward. Would that be acceptable to everybody here? So I just very quickly, so basically we're going to note the beneficial development of a shared care record between health and adult social care, authorises the Director of Adult Services and Health in discussion with the portfolio holder for health, wellbeing and adult care to agree with the integrated care system partners such changes to the Charter as are necessary to limit any unqualified risks to the Council's resources. 3, approves the Director of Adult Services and Health in discussion with the portfolio holder for health, wellbeing and adult care, signing the Charter on behalf of the Council subject to the changes referred to in recommendation 2. Do we need to add anything else to that at this moment in time, or are we happy with that? There's dead silence, so I'm going to assume that we're happy with that, obviously with the caveats we've added. So if we'd all just raise our hands accordingly if we're happy to support that. Fantastic. Councillor Wilby, you supportive? I know you put your thumb up earlier. Brilliant. Okay, so that is fully agreed. Thank you very much. We now move on to item 7, which is the annual report on Treasury management. And I believe, as Councillor Payne isn't here, that Sav De La Rocca, our Director for Resources, is going to present the paper. Over to you, Sav.
Yeah, thank you, Leader. So Councillor Payne has asked me to present the report. She hasn't asked me to highlight any specific issues, but I will run through what the key issues are. When the council approved its budget for 2021 back in February 2020, then at the same time we approved the Treasury Management Strategy. And what that strategy does is set out the council's approach to investments and borrowing. What this report does is summarise what we have done in relation to those areas in the past 12 months. Section 2 of the report on pages 11 and 12 set out the key findings, which I will just run through and amplify it slightly. So the council, as you might expect, has continued to invest with institutions that are approved in our Treasury Management Strategy. That is what we normally do, and it's what we've done this year. The return on investment is low relative to years gone by, and obviously with interest rates being particularly low this year, we had quite a lot more cash this year relative to the past because of the additional grants, government grants we received for COVID, in particular the big sum of business grants that we held for a short period before we paid those out. And with our ability to make some longer term investments in early parts of the year, we did manage to achieve a rate of return of 0.5%. Just to say there that we have looked at other alternatives in the past, in particular looking at property funds, but there are issues, they are routes that we have disregarded for a number of reasons. One being the long-term nature of those type of funds and uncertainty really about where we would be from a cash flow perspective. But it's something that we might look at again. The council didn't undertake any external borrowing in year. That's quite important because when you borrow in local authority terms, you incur a borrowing charge in your accounts, and in effect the borrowing charge would increase the gap in our MTFP. So if we borrow money today, if we borrow £1 million today, then we would incur a charge of say £100,000 in our account straight away. So if you borrow, you increase the financial gap. And of course, as everybody knows, we're trying to reduce the financial gap. On that note, we do look to see whether we can pay off any external borrowing that we do have. If we can pay off external borrowing, then it would reduce the borrowing charge we carry in our accounts and it would reduce our financial gap. Because of early redemption fees, then it hasn't been prudent or financially, it hasn't been a financial business case to do that, certainly in the last 5 or 6 years that we've been looking at that. And then finally, we haven't made any commercial investments in year. Members will be aware that we did earmark some funding provisionally, which would allow members the opportunity to look at ad hoc opportunities to invest in the county in assets that would generate a revenue return that might subsequently reduce our financial gap. As members are aware, we haven't seen any opportunities this year, and obviously because of the pandemic and the position with the economy, it hasn't been clearly the best time to do so. In fact, I know that many authorities that have gone down the investment property route have suffered, in particular this year, with tenants defaulting on payments, with the government introducing the sort of no eviction rule for businesses, then this has affected tenants' payments, in particular the issue around defaulting. One of the other things that's happening nationally is that in the future, lower rent levels are expected because of a depression in the property market. So for those authorities that have big investment portfolios, they have suffered this year. And whilst the government has got a compensation scheme for local authorities that lose income, for example, car parking income or reduction in registrar's income, it's specifically excluded from that compensation scheme compensation with respect to commercial rents. So for those authorities that have lost a lot of money in this area, they haven't been compensated through the sales fees and charges compensation scheme that the government had. So whilst we haven't made any investments in year, it's probably no surprise. And I think as we look ahead, clearly any investment opportunities that may arise, we will, of course, in line with the policy that we have, undertake extensive due diligence to make sure that is the right thing for us. I think the risks are really heightened at this moment in time, so it's not something I envisage us doing in the next year or so. I think we will wait to see how the economy recovers after COVID. So, Chair, that's a summary of the issues. Obviously, in the normal way, happy to take any questions that members might have.
Thank you very much. That was very comprehensive. Councillor Walters, you have your hand up already.
Thank you, Chair. I first of all wanted to say that I think we've got everything right. I think we're in an extremely sound position relative to other local authorities. Our decisions in terms of investing have been proven to be correct, and our decisions not to invest in commercial property or land or anything else is also sound. So praise where praise is due to officers. I just have one question, and that's in regard to the local enterprise partnership loan. I see that we are getting towards the end of that one. Are we thinking that the LEP will actually expect that money back, given that they have treated us? They have not been exactly generous to us with grants, shall we say. Have there been any negotiations on that loan and whether they want it back?
I don't know whether, Penny, you can give any indication. I'm along the lines of you, Councillor Walters, that actually we should argue that it's something that they could leave with us and not expect a repayment, but I don't know if there's any professional input on that, Penny. You're on mute.
Yeah, sorry. No, I haven't got anything to add, but I'm happy to take that away.
I think it's worth taking it away and having a sound conversation about it, and a robust one. Anyone else got any comments or input? I would just like to echo what Councillor Walters said. I think that actually we have got into a good position, and by some sound financial management and guidance from our 151 officer, we are in a much better place than many organisations, and I hear quite a lot of squealing from organisations all around the country who maybe have commercial property in large quantities and have suffered badly. And I think, you know, we are in a good place, and we need to remain on the direction we're on and look for those savings we can find and make sure that we continue to deliver for the county in a long-term picture. So thank you very much, Sav, for your work and for your team. Are we happy to show our agreement with this by a raise of hands, please? Excellent. That is unanimous. Thank you very much. We now move on to item 8, which is the send approval of extension of contract, which I believe is over to you, Councillor Wilby.
Yes, thank you very much, Chair. I'm sure that our new DCS is standing by to give you any detail, but we've covered this a couple of times before. You know that one of the big problems that we have is trying to be inclusive within the county to make sure that we look after all our children who need that little extra bit of help. The cost of sending folk outside the county is really quite prohibitive and very difficult to do. So we've been working for several years now, along with Schools Forum, to try and produce the best early preventative and measures so that we can keep all our children here. We've got a current contract which is going really, really well, and the provider that we are using to train and also to work with our young children is universally lauded by the whole of Schools Forum. I think I have rarely seen such cohesive support from the Schools Forum as was given to the continuance of this report by all the heads and folk who recognise the good work that is going on. We need to extend the contract for a couple of years. It's not a huge amount of money, 65,000, and we know that we have got the budget to do it, but I seek your support for continuing that particular contract with our current provider.
Thank you very much. Councillor Walters, you have your hand up.
Yeah, thank you, Chairman. Councillor Wilby, I absolutely support this paper and your request to extend the contract. It is reassuring to know that so many experts in the education field are supporting what you're saying and that everyone is agreeing with the direction of travel. However, I also worry about parents and carers of children who might see this as simply trying to avoid the cost of specialist provision. What method do you think we can use to reassure parents that we are doing this for the right reasons? I absolutely believe that we are, but I am perfectly aware that parents will sit and say, it is our right, we demand that. We have been to an ombudsman or we have been to a specialist advisor and we demand. So how do we get the message to the parents that we are absolutely doing the right thing for their children?
I see that our new DCS has her hand up.
I'm happy to come back, Councillor Walters. It's an absolutely good point that you're making there, and just to reassure yourself and Cabinet that everything that's associated with our Education Inclusion Partnership is being co-produced with our Rutland Parent Carer Voice, who are incredibly supportive of this direction of travel. We are very much the current coordinator whose contract we want to extend is very much working in partnership with our Rutland Parent Carer Voice to make sure that they understand that this is about getting the right help for their child at the right time as early as possible without the need to go down a very specialised and outside of the mainstream provision. But it's absolutely being done, this piece of work, absolutely in partnership with our Rutland Parent Carers.
Notwithstanding that, Councillor Waters, I'm sure that as we go along our journey, there will be occasions where someone will raise their hand and want something slightly different for their child, and there is absolutely nothing we can do about it. But as our DCS says, we are working in partnership with everyone and keeping the message going out, and in particular listening to the parents to make sure that we are in harmony as we go forward.
Thank you. I think Councillor Stevenson had a hand up and then Councillor Rozelle.
Thank you ever so much, Chair. Firstly, what a lovely report to read, and I think really encouraging, and I wholeheartedly support this. Not least because I think our ambition is that we have a society that is inclusive, whether you're a young person or an old person, and actually that starts with education. And it does worry me that if we take children out of the mainstream education system, what does inclusivity look like for them as they grow up and become adults? So this, to me, I see as a really encouraging thing to enable that big picture of enabling a truly inclusive society from cradle to the grave. So thank you ever so much, Mr. Wilby. Really good paper, and I support it wholeheartedly.
Thank you. And Councillor Rozelle.
Yeah, thank you. I'd like to echo that entirely. I think it's a really positive paper. It's blindingly obvious that the work that goes on in this area is quite superb, and we should be very proud of it. And I do think that when we talk about those families that may feel that their needs are not being met, it's similar to health, actually. The outcomes are what matter rather than the needs of the individual. Needs are something that people would like to have, but the outcomes that we're producing at the moment, I think, are superb. And the fact that we are so forward-leaning and responsive, I think, is a really down to officers' hard work. So I'd like to thank them sincerely for that.
Thank you. And Louise Crookenden Johnson, you have your hand up.
Hello. Yes, I just wanted to add into the point that Dawn was making, actually. Really just to say that Rutland Parent Carer Voice, who we've worked really closely with all the SEND projects, actually are putting pressure on us for this. You know, they want children to be included in mainstream and maintained in mainstream schools. It's actually it's a real strong theme, and we accept that there will be some families, a small number of families who might feel that that isn't the right route for their children, but actually a key part of these projects is changing the message. Actually, it's changing the message about what the long-term outcomes for children are if we don't include them. And I would just add, one of the conversations I've been having with them is, children have to be in the classroom to be included. If we marginalise children, they're not there to be included.
Thank you very much for that. A very valid point. Councillor Walters, you have your hand up again.
Only very briefly, Chair. I'm grateful for the answers that I've received. It's not me that you have to convince, though. It's those parents who will fight so hard against you, and I wish you every good luck.
Thank you. I think just from my understanding of this, that it is actually a slow change of direction and understanding that inclusion is so important for the children developing and growing up. And hopefully we can gradually get there, and it will be a sort of softly approach, I guess, to arrive at the right destination over the next 4 or 5 years. So we have in front of us here the SEND approval extension of contract. I assume we have no further questions, sorry, before I just cover this off. That the portfolio on consultation with Cabinet authorises RCC in acting as the commissioning organisation mandated by Schools Forum to extend the contract for the Education Inclusion Partnership, or EIP, coordination function, and 2, approves the move to a direct award of contract. So I could just have a show of hands that we're all supportive of that for the portfolio holder. Fantastic. Thank you very much for that. We now move on to item 9, which is the COVID-19 update and approach to continued use of emergency powers. And this one falls to me. Back at the Cabinet meeting held on the 21st of April 2020, it was agreed that Cabinet would keep under review the use of emergency powers, and this is where we are today. So the government has laid out various roadmaps. On the 5th of July, the Prime Minister announced removal of restrictions on the 19th of July. And obviously, there's no limits on social contact, 1 metre plus rule removed. This may remain in medical settings. No legal requirement for face coverings, although face coverings will still be advised in hospitals, healthcare settings, in closed, crowded public spaces. Nightclubs permitted to reopen. Capacity caps on businesses will be lifted. Hospitality businesses will no longer be required to provide table service only. No limits on numbers at weddings and funerals. No restriction on communal worship and singing. No limits on people attending concerts, theatres or sports events. And no legal requirements for COVID certificates for any venue or event. Now, it is also suggested that the guidance on the working from home will end, and limits on named visitors to care homes will also be removed. It is still important that we still are in a pandemic, and I know we're coming out of it, but from my point of view, I think it's important that we still remain vigilant, and I've seen advice saying that actually we should clearly remain, if uncertain of spaces we're in, we should wear face masks, we should wash our hands thoroughly, we should take all the precautions that we have been taking, but just understand that we are now a little bit more relaxed. Testing and contact tracing will continue for those with symptoms, and people will still be legally required to self-isolate if they test positive. We are expecting some further announcements on the removal of school bubbles, and I guess that may not happen until September. And removing the need for fully vaccinated people to self-isolate on return from amber list countries. At the time of writing, cases in Rutland have actually been creeping up, and I've got a figure here of 188 per 100,000. I think it's actually slightly higher than that today. I'm not sure whether Mark's nodding his head. I think it's nearer 300, isn't it, per 100,000?
311 per 100,000 population.
Thank you. This is very much in line with the national picture. And what the last thing I'd really like to bring your sort of notice to is obviously, or 2 points. One is that the vaccinations have obviously had a really good uptake in Rutland, and we're still continuing with that. And the use of emergency powers, which is what this paper relates to, is actually we haven't used any since April of this year. And the council is finalising its policy on the use of some of its discretionary additional restriction grants. And this will be recorded as a decision in a log of due course. So are there any questions or comments? Councillor Walters, you have your hand up.
Yeah, again, only briefly on the substance of the report in terms of keeping the emergency powers or the emergency delegation, I fully support that. We're not out of the woods yet. There will be ongoing government directions that need a very prompt response. And it is not necessary always to bring those to Cabinet or to Council. So I'm fully supportive of continuing with the emergency delegation situation that we have now.
Thank you very much. Are there any other comments on this paper?
Sorry, Leader.
Thank you very much.
Sorry, just
Yes.
just one other thing was just that once we're a bit clearer on the next steps, the impact of the unlocking and where we might go nationally, we'll know more in the next sort of 3 weeks. There is an intention that we will then bring forward some recommendations to amend the scheme of delegation, so that we can move away from emergency powers and just ensure that the response to this pandemic is catered for. There are some aspects that are in terms of our responsibility around public health, but some of the signing off of resources in combination to our tackling of those aren't in the scheme delegation. So we'll just make sure we bring something, but we'll wait until we're just a bit clearer on what the longer term picture is.
Thank you very much for that, and I think that's a very pragmatic solution there. So the recommendations are that the portfolio holder and Cabinet note the present position in Rutland in respect of COVID-19 and note the continued applicability of the civil emergency delegation. So if you could just show if you're in support of that generally, please. Fantastic. Thank you very much, everyone. So I believe that we have now come to the end of the business today, as there are no other items. So I declare the meeting closed at 10:44. Thank you very much, everyone, for attending. Thank you.